Okay, lumps and bumps after liposuction. I've spent the last 3 years obsessed with lumps and bumps after lipo. And we don't want lumpy, bumpy skin to ruin a very nice shape, a very good result. We want you to have smooth skin, no fibrosis. The best way to do that after surgery is to use a roller. And the rollers will be used over top of your faja on day 1. And then as you start to feel more comfortable, you're going to start to be able to roll your skin just like you're rolling out dough. I recommend patients do that for the first 2 weeks. Then after that, we turn on the vibration, we put it on the highest setting, and then gently roll it in one direction. So no longer like this, but it's very light, barely any pressure, right on your skin, and you roll it towards the groin. And you roll this half to that groin, this half to this groin, you pick it up, and you do it again. Seems like you're doing nothing because it's just very light vibrational. But what this is doing is this is activating the lymphatic system, and it's opening up those lymphatic channels. It's allowing that fluid to get out, and it's the fluid that's being trapped in there, and that's giving you the inflammation, and that's giving you scar tissue, and that's giving you fibrosis, that's giving you lumpy skin. So we want activation of the lymphatic system. We want that fluid out of there. We want those inflammatory mediators that are hanging around there after surgery in the fluid. We want those out. The other thing that we use is something called Fibergard. This is worn starting 2 weeks after surgery to, again, yes, you guessed it, activate the lymphatic system. By doing that, by these little foam balls in here, it's creating little tiny micro movements even as you're breathing or as you're walking. That's activating the lymphatic system, that's getting that fluid out of that area and getting rid of all of that inflammation. Yes, I think it really works. I've noticed it. I've seen it myself. I've had patients come back a month after a tummy tuck, and to me they look like they're 3 months out. Their skin looks great. If you want to prevent yourself from getting lumpiness or fibrosis, you got to take care of skin. You have to put in the effort. I'm only doing surgery for 2 or 3 hours to remove the fat, but then you have 6 months to a year to affect how that skin looks. So you have to do a lot more work than I do. I will give you the shape, and then I'll harp on you about all the things you need to do, but ultimately you need to do them to give yourself the very best result.